If you're someone who's experienced denial of services for mental health or substance use disorder coverage, it's possible that you've experienced a violation of a federal law known as the Mental Health Parity and Addiction Equity Act of 2008. This law was put in place to protect people with mental health conditions and substance use disorders when they experience unfair insurance practices. Some of these examples of unfair insurance practices, if you've been denied care because your insurance company said it wasn't medically necessary. Because of this federal law, those things are supposed to be a thing of the past. Unfortunately, as we've seen in many states, including here in New Jersey, that is not so much the case. Sometimes insurance plans still are not complying with this law. The good news is that here in New Jersey, there's a coalition working to help you get the coverage you deserve. The New Jersey Parity Coalition is working very hard to make sure that insurance plans comply with this law and also comply with sections of New Jersey law that are also meant to protect individuals with behavioral health conditions. Here in New Jersey, some of the work that we're doing is a collaboration of many organizations interested in advancing the interests of individuals with mental health conditions and substance use disorders. Part of the work we're doing is also being coordinated with some national organizations, and the goal of those national organizations is to make New Jersey the crown jewel in terms of enhancing parity implementation in the United States of America, with New Jersey being the gold standard. The reason the national organizations have thought that may be the case is because of some of the great work that is taking off the ground right now with some of the organizations we have working together in this state. What's really encouraging is there are a lot of passionate advocates working to help individuals with mental health conditions and substance disorders get the care that they need and the care that they deserve. And what's also important to understand is that this is care that you pay for. When you pay for insurance or your insurance is provided by your employer, that is behavioral health coverage, like coverage for mental health conditions and substance use disorders. That is part of what you pay for. And if you're not getting that care, your insurance plan is not being accountable. So that's something that we're trying to work to make sure that that is a thing of the past, and that parity is a reality for everyone throughout the state of New Jersey.
I'm the mom of two wonderful young men who are currently in their 20s. My sons are also both addicts, and they both experienced the need for inpatient treatment because of the progression of their opiate-based diseases. Both my sons were denied treatment. My first son was denied treatment right from the beginning by our insurance company, and my younger son was denied treatment after 2 weeks of being assigned to an inpatient facility. Since the denials, I have been working diligently through responding to these different levels of denials, to gathering data, gathering medical records, and working through finally to a hearing with our state commission. I have found this exhausting, burdening, and completely overwhelming. And I know that many other parents or family members of loved ones facing the same deluge of denials would be completely exhausted and possibly not have the energies to deal with this. In our sons' cases, we were fortunate to have some savings set aside for our pension years, and we had to use those to pay for the treatment. Otherwise, our sons would have been discharged. We know that when discharges happen too soon, relapse often follows, and frequently the outcome is jail or death. My goal now is to shed light on these denials, to talk about the victimization of our sons in terms of denials by our insurance companies and the violations of the Parity Act, which requires that insurance companies treat those with brain diseases such as mental health and addiction equally to the way that people with other medical conditions are treated, such as diabetes, heart disease, or broken bones. I would very much welcome other parents' testimonies, and I can be reached at denied.treatment@gmail.com. I want to be part of the solution, and I ask that you join me. Thank you.